Hello again. We are talking about the thoracic cage in this very short video and the last one in our series on the axial skeleton. So the thoracic cage protects organs in the chest, and it's going to provide sites for muscle attachment. So we want to think about the fact that it's going to provide bony support to the thoracic cavity walls, which means it can protect the heart, lungs, your thymus, and other thoracic cavity organs. It's going to be made up of the thoracic vertebrae that we learned about in a previous video, the ribs, which we're going to learn about in this video, and the sternum, which we're going to learn about in this video. So the ribs and the sternum together will form the rib cage or the thoracic cage. The muscles that are involved with attachment in the thoracic cage are going to play critical roles in breathing, maintaining the position of the vertebral column, so your posture, and also moving the pectoral girdle and the upper limbs, so your arm and shoulder is what we're talking about there. So let's get right to it. Most people know about this sort of flat sternum bone right in the center of your chest. What you might not know is that it's actually broken down into three parts. So the top portion of it is the manubrium, and in the manubrium is the jugular notch. So that's pretty a defining characteristic of the manubrium. Below the manubrium of the sternum, we have the body of the sternum, and at the inferior aspect of the sternum, we will have the xiphoid process, which is just a little piece that sort of hangs off the body. And if I switch to this larger picture, we can see them here. So there's that jugular notch at the superior aspect of the manubrium of the sternum, and inferior to the manubrium is the body of the sternum, and then the xiphoid process hanging off. And you'll also notice in this diagram that we can see the ribs, right? And in this case, we can see first rib right here, coming all the way down to rib 10. And if you look back here, there's 11 and 12 hanging out. So 11 and 12 don't really come around far enough to the anterior that we're able to see them. And you'll also notice that the ribs start back. They articulate at the vertebral column, and then they swing around, forming this cage. And in some cases, they will attach essentially directly to the sternum. And in other cases, they connect into some cartilage, which then connects to the sternum. So you'll notice these ribs 1 through 7 will be called the vertebrosternal ribs or true ribs. So they are connected to the vertebral column and connected to the sternum. Then we will have the vertebrochondral ribs, which are going to be 8 through 10, because these are going to connect into cartilage, which will then connect to the sternum. And then we have ribs 11 and 12, which are known as floating ribs or the false ribs, because they're not going to connect into anything other than the vertebral column at the back. So let's look at the ribs in a little more detail. 3 bony landmarks on the ribs that we need to know about are described on this slide. We have the costal groove, and you can see that right here. This is where nerves and blood vessels will run along the rib. We're going to have the long shaft portion of the ribs, that's the tubular portion, and then there's the part where it bends, and that's going to be the angle. And on my next slide, we have the head or capitulum of the rib, which comes after the angle. And we will have some articular facets on the head here and also here. And then this piece right here, this facet is a tubercle. Coming back to my first slide, I just want to point out that the space in between the tubercle and the articular facets is the neck. So we have the costal groove, the shaft, the angle, the head or capitulum, and the tubercle. And coming here, we can see how the ribs articulate with a thoracic vertebra. So this would be ribs 2 through 9, and we can see the heads or the capitulum of the rib will articulate with the costal facets of 2 adjacent vertebra. So each rib is actually touching 2 vertebra. Ribs 1, 10, 11, and 12 are a little bit special because their heads will articulate with a single costal facet of an individual vertebra, so not 2. And the tubercular facets of ribs 1 and 10 are going to attach to transverse costal facets on the vertebra. And there will be no tubercular facets on ribs 11 or 12. And lastly, we need to understand how ribs move. And a good description of this, or the analogy that your book uses, is that ribs act like a bucket handle. So if you think about the handle on a bucket that you can lift it up or you can lay it down onto the side of the bucket. You can hold it out to the side horizontally, and then you could push it up or push it down. So if you push down, then the ribs are moving inward. And if you pull up, then the ribs are moving outward. And that's going to affect the width and depth of the thoracic cage. So that's important because when we breathe in, we want to be able to increase the volume of the thoracic cage. And when we breathe out, we want to be able to decrease the volume of the thoracic cage. So that's it for the thoracic cage. There's not as many bones and bony landmarks to know in this one. You want to focus back here on the structure of the ribs and a little bit on how they articulate with the vertebra, and then keeping in mind the structure of the sternum, and then how the ribs articulate. Do they articulate with the vertebral column and the sternum, just the vertebral column, and then cartilage to the sternum, or literally only the vertebral column? And that should put you in a good place as you get ready for your next assessment.